I've been asked if somebody with a rounder face and chubby cheeks is a good candidate for facelift. Well, there are various factors that need to be taken into consideration when we're talking about faces that are rounder or they have chubby cheeks. First and foremost, what is your body weight? There are elements of facial fat that are very difficult to lose, even though you might be super fit. Then also, if you have a round face and you're starting to lose face, well then wait until you have lost the face and face off. So once you picked up your face, okay, now there are some areas in our face that are quite sturdy. You can have big mesenteric muscles. These are the kind of clenching and jaw muscles. And if they are very, very thick, you just inject some Botox, they slim everything down. So the kind of squared angle or squared appearance of the jaw can be slimmed down. Now, if you also have buccal fat space that is very full, buccal fat is really sturdy fat, doesn't go away when you lose weight that quickly. You might be looking into having a buccal fat pad reduction, but let's also be realistic. A buccal fat pad doesn't do anything else but like a subtle nuance of devolumization of your cheeks, similar like you would be sucking your cheeks against your teeth when you take a selfie to look extra cool. You're not pouting your lips, you're not giving your model face, because sometimes I have patients that do Zoom calls with me and they're thinking of having a buccal fat pad reduction and then they do Zoolander, and like, that's not a buccal fat pad reduction, that's Zoolander, that's blue steel, that's called blue steel, this look. So you have to be realistic. Now, if you have a round face, then obviously, you know, there are other elements like bony structure and other soft tissue, and the question is, do you really want to change all of this? Because some of it is just your appearance. So some of it is devolumization that can be combined with a deep-plane facelift. So during the surgery, I can reduce some fat depots in your face, but let's not forget that we're also repositioning those fat depots. So very often, if the roundness and heaviness sits here, as we lift this up, we bring the volumization again to the cheekbones, and that already makes a fresher and younger appearance. So overall, there are options, but it really depends how old you are, what the anatomy is, and what your goals are. Don't do the blue steel. Zoolander could do it better than all of us.